Women are having vaginal surgery to be more comfortable on their bikes. You know that feeling you get while you're on a long bike ride? No, not the sweaty, out-of-breath feeling. We mean the one in your vag. For some women, it's painful as hell, and they're not going to take it anymore. A growing number of women are getting labiaplasty. That is surgery to shorten their labia minora, the inner lips, so they can bike more comfortably, according to the UK's Daily Mail. If you're not a big biker and aren't acquainted with the soreness we speak of, it happens when the labia become chafed, pinched, or trapped on a bike seat, which feels about as good as it sounds. But is the surgery really necessary? If women are truly uncomfortable wearing tight clothing or riding their bikes, then it is an appropriate procedure, says board-certified Obgyn Paragodsi, MD, but I do not recommend it purely for cosmetic reasons. Lawrence Straicher, MD, an associate professor of clinical obstetrics and gynecology at Northwestern University Feinberg School of Medicine and author of Sex X, Hormones, Health, and Your Best Sex Ever, says women often get the surgery because they're frustrated for a number of reasons. Among the biggest complaints she hears from patients, urine gets all over the place when they pee, because their longer labia gets in the way of the stream, the labia gets folded up and caught during sex, and, of course, there's the bike pain. Straicher says she does a lot of consultations for labiaplasties, and many times women decide not to go through with it. Some women just want reassurance that they're normal, she says. For those who decide to do it, Straicher basically trims off the end of the labia, and that's it. In general, people are very pleased with the results. There's a minimum of discomfort, she says. If your labia is long enough to classify for a condition called labial hypertrophy, your insurance might cover the procedure. Of course, all surgeries have risks, and Godse and Straicher both say it's important to have a long talk with your doctor before deciding on this one, even though it's minor surgery. Not exactly digging the idea of having your lady bit trimmed, and aren't 100% sure if your labia is to blame for the pain? Godse points out that your bike seat might be the issue. I would recommend padded seats, she says. You can also, arrange yourself on the seat, says Straicher, and wear bike shorts with extra reinforcement, padding in the crotch area. If chafing is an issue, she recommends putting a little petroleum jelly around your labia. But, if you're still having issues, talk to your doctor.